questions that you think of later, don't be afraid to send them to Mr. Borden or Mr. Robbins, and we will send them on to try to get answers. We're going to open up an informational hearing on the Department of Corrections. Mr. Robbins, welcome.
Thank you.
All right. Mr. Reese, do you have just Director Reese? Okay, good to see you. Please introduce yourself and tell us what we need to know.
For the record, Co-Chair Evans and Co-Chair Broadman, my name is Mike Reese, and I'm the Director of the Oregon Department of Corrections. And I want to start by thanking all of you for the work you're doing. I know that this is a difficult process to go through. You have difficult decisions ahead of you, and I don't envy those. As the superintendent said, our public safety system is a continuum, and moving one part of it or cutting in one area can have an impact on another area. And I know as you weigh these decisions, you're aware of that complexity with public safety work. And so I just really want to honor you and say how much I respect you for these difficult decisions ahead of you. So the Department of Corrections, we did a process. Let me try this then. I'm not getting this to, there we go, thank you. We did something similar in our analysis that the state police did. We started looking at it through the lens of our mission and our strategic priorities. And the timing for this conversation internally for us was really good because we are in the process of developing a new strategic plan. You've seen our new mission statement before. We're here to protect communities, promote accountability, and transform the lives of the adults in custody. We analyzed these cut processes through our mission, the strategic priorities, and the impact they would have on other public safety partners and public safety of all Oregonians. For example, if we were to close an institution, it has an impact on community corrections as more offenders are released onto supervision. It may put pressure on police departments and sheriff's agencies as more people come into contact with local law enforcement that are released back to those communities. So I wanted to highlight, if we could go to the next slide, please, our strategic priorities. As we jump ahead for the next 3 years, we're looking at a continuum of care for adults in custody from entry into our system to reentry into the community and back onto supervision, and making them set up for success so that they don't recidivate and don't reoffend when they're back in their local communities. We looked at these budget reductions through the lens of our employees. We want to make sure we're hiring the right people and that we're equipping them with purpose and a sense of accountability for getting the job done. We're modernizing and updating systems and processes within DOC to create efficiencies in our operations that save you money. And then finally, one of the things that I'm most excited about is a commitment to professionalism. We did an employee survey as part of our strategic planning process, and our employees said that they want professionalism as one of the key values for our organization. So that's the lens that we looked through for this budget cut process. So as we go to the next slide, please. We met several times as an executive team. We drilled down into our leadership team as needed for information. We also talked to some of our partners at a high level, much like the state police, so that we were able to have conversations, but without potentially impacting employees ahead of, getting ahead of a process. And as I really respect what the superintendent said, when we put these budget cuts out there, employees see in those cuts their position, their name, and a very personal impact on them. And communities feel that same sense of pressure, even though this, is part of an exercise. The exercise in itself causes anxiety and stress on communities and our employees. So as I stated earlier, we started with looking for efficiencies within our system. We are a very large public safety agency, and I have been committed since I became director to finding efficiencies that we could repurpose back into providing adults in custody with the tools and resources they need to be successful, and also to make sure our employees feel valued for the work that they do. Some of those efficiencies that you see in here are things like moving our headquarters building. We're in a large, ubiquitous office building that is not owned by the state. We have started the journey months ago of moving back into state-owned property so that we can save money and repurpose it back into public safety. We're looking at creating positions within health services that better align the work to the position. So we've been challenged to find nurses in our community. We're using contract nurses, which are wildly expensive. If we can fill some of these positions, vacant nurses positions, with CNAs or medical assistants, we not only align the work better, but we also save money in that process. We looked at the impact of these cuts on all of our services. And if we were to simply eliminate, like, correction services, one of our largest divisions, and say we're no longer providing services to adults in custody, so no education services, no religious services, no intake counselors, no corrections counselors, no release counselors, all of the processes that go into that, it would be about $129 million. It would barely meet the 5% cut and not actually meet the constitutional mandates that we have to provide for the adults in custody. So at the deeper level of cut, we really started to see fairly significant impacts on our organization, closing institutions and releasing adults from custody sooner than they should be released because of the closure of a facility and not preparing them for that. We also, at a lower level, looked at things like modifying operations. So a lot of our staffing costs are associated with overtime. We want to reduce that, but the overtime goes into paying for modified operations and security to allow for more visitation, more programs. So when we have community events that come into our institutions, we are hiring on overtime staff that are necessary to provide the security for those programs. So as we look at cutting overtime, we're looking at how do we modify operations systemically across the organization so that we can allow for as many of these types of events to happen and keep the adults in custody engaged and productive without causing unintended consequences. So we talked to community partners in education. They said, don't reduce your staffing halfway through a semester, because we've got adults in custody that have paid for educational services, and we want to make sure that they complete those classes before you make any changes in operations. So those are some of the types of exercises we went through as we got to this. If we could go to the next slide, please. There we go. Thank you very much. So at the lower end of impact, we talked about efficiencies, reductions in travel and training, cutting supplies, contracted personnel, so cutting some of those contract nurse positions, contract doctors that we have coming in, timing the adjustments, so delaying hiring and creating savings through vacancies, capital improvements, pausing those if they're general fund budgeted, maintenance projects, technology replacement, delaying things of that nature. Modernization will help us as we complete the rollout of our electronic health record system. We know that we're going to create efficiencies in our operations that will reduce the cost to the business that we're doing. And I want to say that OSP, the rollout of the electronic health record system there, has gone fabulously well, and I want to shout out to the staff that have made that happen. And then finally, as we got deeper, as I said, the cuts to core programs will impact the safety of our institutions and our ability to help the adults in custody prepare for release. Cutting substance use disorder treatment programs, medication for opioid disorder, those are going to definitely have an impact on the adults in custody and their ability to reenter our community safely. And then finally, closures of South Fork Forest Camp and EOCI, as you saw there, will have an impact on not just our adults in custody and the community, but other partner agencies like the Oregon Department of Fish and Wildlife, and Oregon Department of Forestry. with that, I'm happy to answer any questions. Thank you for your time.
Okay, I see none. Oop, I see one.
Thank you, Co-Chair Director. And this is not a question to answer today or necessarily in writing in the future, but I want to know if the agency would need a statutory change if community corrections were to play a larger role or to play a role in deflection. If we were doing more with community corrections within the deflection system, as we're looking for more efficiencies in the system as a whole. Something I look forward to talking to you and Jeremiah about in the future.
Thank you.
Senator?
Mr. Co-Chair, thank you. Director, I will be seeing you tomorrow in my committee. You had mentioned a little bit about the healthcare issue or crisis, I'll put it like that. I understand from the last time I toured the facility, or Coffee Creek, there was conversation about contract nurses coming. I know that it costs a lot of money to do that. I'd be interested in, you had mentioned CNAs and stuff, what that would look like. I know that we have approved the community colleges for nursing, bachelor's in nursing degree programs as well. And we have some other programs that will help some of these future RNs and stuff kind of get low-level stuff, you know, not the major things. But you also have a growing number of bedridden adults in custody. They can't move. CNAs will probably be a good source to help them to some degree. So I'm looking forward to the presentation tomorrow. I'd really like to know more. The other thing is, as a former Missouri State Penitentiary Corrections Officer, it's hard for me to see you doing any cuts. The penitentiary is crumbling. Your infrastructure is bad. Every year we go in and there's always reductions and stuff. What I would like for some of the agencies to come by with some of the things like, well, we can eliminate mopping for a month or something like that. All of these programs are critical. So bring something that's easy so I can say, yeah, let's reduce that. Okay, no sugar for a month. All right, let's do something like, bring us something that's small. Everything that comes before these committees are crucial and critical. And that makes it very difficult for me. And I know my colleagues are sitting up there going the same thing. If we pull one stone out, the whole thing may just crumble.
Really?
Yeah.
Okay.
Thank you, Co-Chair. The mopping lobby is going to be at my door now, Senator. Thank you for the presentation. Community corrections is all over at different levels of these cuts. Can you just speak a little bit more to, if we cut community corrections, is that less supervision or is that less people being supervised? And if they're not being supervised, does that mean they're off supervision or that they're in custody? And then I think the last layer of that is it a true savings or is it just kind of shuffling where that spending ends up being? And if that needs to be in writing, great. I just wanted to kind of put those thoughts out there.
Co-Chair Evans, Co-Chair Broadman, Representative Choatson, I think there are 3 layers of cuts to community corrections. As we partnered with community corrections talking about this internally, we were trying to prevent an opt-out option. As you know, if we fall below a certain funding level, the state then is at risk for counties opting out and giving back to the state community corrections. And we wanted to do everything we could to make the cuts in community corrections less dire than that. And so we started at looking at civil fines and court fines and things of that nature, cutting pass-through funds, and then looking at cuts to other funds, and then finally to the direct cost to community corrections. So it's very complicated. We tried to create a budget options for you that would not trigger opt-out. And I look forward to having that conversation internally with our community corrections partners about the potential of doing things differently.
Okay, thank you. We're going to close the informational hearing on Department of Corrections. We're going to open up Informational hearing on the Oregon Youth Authority reduction options.